How to Drug Detox. Part 1. Drug withdrawal occurs when a person who has used a particular substance for long enough and in sufficient quantities to become addicted to the drug, whether it is physically, psychologically, or both, stops using it. Abstinence is the process by which that person's system readjusts to the absence of substance. During this period of readjustment, a variety of symptoms, usually unpleasant, may appear, collectively known as withdrawal symptoms or withdrawal syndrome. Withdrawal varies in terms of its effects and duration depending on a number of factors, including the addict's age and physiology, the type of drug used, the duration of the addiction, the doses are taken, the pattern of use, and more. Abstinence lasts until a person's system has fully readjusted to life without the substance in question. With psychological dependence, it can mean several months or even years after the last dose, although weaning is usually completed in 1 or 2 weeks. How to Drug Detox, Psychological Abstinence. Psychological withdrawal occurs when a person is dependent on a drug that is not necessarily physically addictive but on which they have become psychologically dependent. This means that they will take the drug knowing that it is having adverse effects on their lives, and that they will obsessively think about obtaining and constantly using the drug. Drugs will dominate your daily life and could have very negative long-term consequences on your mental health. Psychological withdrawal tends not to produce physical withdrawal symptoms, although many addicts have psychosomatic symptoms. Instead, psychological symptoms are likely to manifest, which may include constant cravings, insomnia, mood swings, and depression, etc. Therapy is invariably necessary to overcome a deep psychological addiction and can be invaluable in combating relapses, as the temptation to give in to temptation is psychological in nature. What is physical abstinence? Physical withdrawal occurs when a person has become physically dependent on a substance. This means that the parts of the brain responsible for regulating certain bodily functions have become dependent on the presence of this drug in the system and require this drug to function normally. When the drug is withdrawn from the system, that is when the user stops taking the drug. The aforementioned parts of the brain enter a period of abnormal functioning during the withdrawal period, that is, until a person's system readjustment to the absence of drug. And a number of physical symptoms of this abnormal behavior can occur. As noted above, some substances, especially alcohol and benzodiazepines, are so physically addictive that withdrawal can be fatal without proper medical attention. Physical abstinence tends to last between a week and a fortnight depending on various factors. The symptoms disappear once the user's body gets used to the absence of the drug again. What medications cause withdrawal symptoms? In fact, any addictive drug can cause withdrawal symptoms when you stop using it. If a person has become psychologically dependent on a substance, they will almost certainly suffer some form of withdrawal once they stop using it. Withdrawal symptoms aren't just one factor in illicit drug addiction. Prescription drugs, while used therapeutically, can also be addictive. Similarly, legal recreational substances, including alcohol, as noted above, one of the most dangerous substances in terms of withdrawal, can also cause withdrawal symptoms. In other words, the legal status of the substance is irrelevant when it comes to whether or not it poses a risk of withdrawal symptoms. Opioids including heroin, morphine, and various prescription drugs, are highly addictive physically and psychologically, and withdrawal symptoms are notoriously unpleasant and often painful. They can include stomach cramps, nausea, vomiting, fever, and other flu symptoms, muscle cramps, and spasms, sweating, urinary problems, diarrhea, headache, restlessness, and irritability. Some of these symptoms can be dangerous or even, in the case of some drugs such as alcohol and benzodiazepines, fatal. Also, withdrawal symptoms can be so unpleasant that some drug addicts experience suicidal thoughts while going through them. Subscribe our channel for future videos. Visit our website holisticmeaning.com for more informative articles.